I'm happy to be with you in the EBMT in Frankfurt. The topic is about the conditioning regimen in the hematological malignancies. Obviously, we don't have actually established, well-defined conditioning regimen based on the different diseases in hematology. So I think that we need to establish a platform in the future based on three things. The first is the comorbidity of the patient and the age of the patient. Second, related to the disease, acute leukemia versus lymphoma patient. And third, the type of transplant, full match sibling or unrelated donor, or maybe a haploidentical transplantation. Saying this, the conditioning regimen should be separated in three types. One, to induce the control of the disease, especially if we have an active or a refractory acute leukemia. So we need to increase the intensity of the conditioning with, on the other hand, lower toxicity. So we need to move on versus a new conditioning regimen, introducing a new drug, maybe with a good control of the disease, good penetration of the central nervous system like Tiotepa or others, including immunomodulatory drugs, and maybe trying to find the best dose of ATG in the conditioning regimen. On the other hand, we need to establish a good immunosuppression to decrease the risk of acute GVHD and the toxicity post-transplantation. Saying that, the new era of the conditioning regimen should be a new era to control the disease, to decrease the toxicity, and to give the opportunity of our patient to have a long-term remission, and obviously, hopefully, to be cured from the malignant disease. So the future is based, I think, to have the best dose and timing of this new drug in the conditioning regimen. We are working for many years to establish and to find the best dose of busulfan IV, to find the best dose of Tiotepa, 5 milligram kilo or 10 milligram kilo, the timing of the administration of this drug, the dosage and the number of days of ATG also, and obviously maybe immunomodulation post-transplant should help this conditioning regimen to perform the control of the disease and to decrease the risk of relapse in the future. I think we need a lot of work in the future with a randomized study, hopefully, or maybe multi-center trials is feasible. We have a lot of patients, so we can do this to find the best regimen of conditioning. Moving from the old concept of conditioning regimen using cyclophosphamide and TBI, or cyclophosphamide and busulfan, because we are in a new era of transplantation. In this way, we need to find this best conditioning regimen called reduced toxicity conditioning regimen to perform a control of the disease and to take into consideration the specificity of each disease, like acute leukemia and lymphoma patient. So in this way, I think that we can give to our patients the chance in the future to be cured from the malignant hematological disease.